Welcome to The Buzz, where we bring you leaders in dental education, discussing hot topic courses and industry trends. I'm your host, Vanessa Emerson, founder of Dental Speakers Bureau, and today I'm very excited to be here with Casey Hein. Welcome, Casey.
Hi, Vanessa, and thanks for inviting me today.
Absolutely excited to do this with you. Now, Casey is a visionary behind the real-life application of periodontal research and a pioneer in building dental-medical collaboration. She speaks on a variety of topics in this area, and we've chosen for the purpose of this interview to speak about her course that is entitled A Best Practice Approach to Target Diabetes in Dental Patients. Now, we all know that diabetes, that's a very important topic and subject, and what I would love to ask you first as we get started, Casey, is what's happening at the dental professionals end that would help them choose this course for the meeting planner who's considering bringing this. What's happening for those dental professionals that this course will help resolve?
Right. So, as you know, diabetes is a pandemic throughout the world. I think it's estimated that today there's about 300 million people that have it, and that expectation is that it's growing. There have been many authoritative calls for action that all healthcare providers be involved in this pandemic of diabetes. And I don't think as oral healthcare providers, meaning dentists and dental hygienists and dental assistants, I don't think that we can be exempt from that. I think we have to dig in and be involved. What's exciting to me is, and I've been watching this for 20 years now, is the new code that the American Dental Association came up with for chairside testing for Hba1c, which Hba1c testing is the average measurement of a person's metabolic control over their sugar for about 3 months. And so now we have a chairside test that we are able to administer, and there is a procedural code for that. And I think that's really exciting. And I can tell you back in the 1960s is when they decided that screening for hypertension should be a standard of care. Now, that was before I practiced and before I went to school. I want to be clear on that. But so we have been, monitoring people's blood pressure for many, many years. That's the standard of care. And I believe that screening for diabetes and differentially treating for patients with diabetes will become a standard of care very soon. And we need to be ready to do that.
Agreed. So in this course, what type of things, could you give us just a couple, bullet points? What will we learn in this course?
Well, one of the things that I strongly advocate for is learning how to screen, not diagnose, but screen for diabetes. We know today that there are quite a few patients who come to our practices that have asymptomatic diabetes. And the American Diabetes Association publishes annually updates on their standards of medical care and how to screen. What are the criteria for screening people for diabetes? So in the least, to screen patients for those criteria, and patients who test positive or screen positive for those things, those are people we need to make referrals for. So that's one thing. The second thing is learning how glycemic control is related to oral health and specifically periodontal health, understanding this whole body of evidence of the relationship between periodontal disease and diabetes. And it is an interrelationship. Today, we've known for many, many years that people with diabetes are more prone to infection, and that includes periodontal disease. And once periodontal disease, that makes it more difficult to control blood sugars. What has not been known is that it goes the other way too, that there's some very excellent evidence that periodontal disease may actually increase the risk for diabetes, and it's through that insulin resistance syndrome. So understanding how all these, metabolic syndrome and what all these things are that place patients at risk for this, and understanding differentially how to how we're going to treat patients with diabetes compared to those who do not have diabetes. For instance, prioritizing infection from any source, and that's not just periodontal disease. It could be any source of infection in the mouth. How important it is to monitor clinical outcomes of treatment. That's super important because closely, because that may tip us off to a problem with metabolic control. Understanding how well a diabetic manages their blood sugar levels is important when we try to figure out how to treat that patient, whether a non-surgical approach over surgery is indicated, or whether we venture into full mouth restoration. And I could go on, but honestly, we do need to treat people with diabetes differently, and understanding that. Being prepared for a glycemic event in the office, how we treat that, etc.
Got it. Awesome. So this course then, would it be typically for the doctor and hygienist, or who do you recommend attend this course?
I think it's important that everybody in the office attend this course, and that includes the people at front desk, the business people. And I've done this course for teams, for team building days, and I think it's so important for all these courses that have to do with oral systemic or periodontal systemic interrelationships. I think it's super important to do them for the whole office, because it's important for everybody to have the same practice philosophy, so we can reinforce each other's messages, and it's important to be on the same page.
Oh, that's great. Now, I'm wondering more about the format. Is it typically a lecture, or if we're bringing the entire team, is it something where they can kind of work together and work on protocols for their office? And also, when you answer that, could you give us an idea of the ideal length for this course?
Yeah, so I'm really glad you asked that question, because I believe there's hands-on experience is so important in participation. And one of the things that I do is case-based learning. So to be able to provide cases that actually have all sorts of interesting twists that include front desk quagmires and challenges to clinical care, and to distribute these cases, it'd be ideal to do it before the program, and to be able to actually have people be able to collaborate on this and actually participate in this. And what are you going to do differently? How are you going to resolve this issue with this patient? And what are the key messages for patient education here? What are you going to have to do in terms of getting complete acceptance of treatment planning and those kinds of things? It's really important. So it's a great team course for teams and a lot of healthy interaction.
And so let's wrap this up with a question on, is there anything that we haven't covered that would be important for the event planner to know, for someone who's considering bringing you in for their conference or their study club, or no matter the size of the meeting? What might be important that we haven't chatted about that the event planner should know?
I believe that this area of medicine we call periodontal systemic medicine, and its application to everyday patient care, is perhaps the most exciting opportunity we've had as oral healthcare providers to really define our that's great. No, that's good. I love it. This is an exciting body of science, and I think it really does help us redefine ourselves truly in the healing arts. And the reason I say that is because people get excited about this. We also know that when you practice like this, it's an integrative approach. You start collaborating with the medical profession on this. We really do know that it is exciting for professionals to practice at this level. They're great practice builders. We also know that patients, the research we have is that they love it when we ask these questions about their health and what is your Hba1c, and the opportunities to actually interact with the medical community, the nurses community, diabetes educators, et cetera, et cetera. We also know that non-dental healthcare providers like physicians and nurses say, bring it. They love the fact that we are integrating this with overall health. And this is the future. This absolutely is the future. So I think we need to take those baby steps forward and swallow hard, feel the fear, and do it. Get it done, because it's wonderful to be able to practice at this level.
Oh, agreed. And I think it's a very important topic. And so thank you so much, Casey, for sharing your knowledge with us today, sharing with us a little bit more about this course, a best practice approach to target diabetes in dental patients. You can find out more about Casey's programs at dentalspeakersbureau.com, where you'll find her listed under our Find a Speaker section. You'll find her contact information there. And if you'd like to reach out to info@dentalspeakersbureau.com, we'd be happy to connect you. So thank you, Casey, and everyone, until next time, be well, and we will be seeing you back here on The Buzz soon.
Thanks.